Unsafe, uncaring and dirty. Damning words used by the health watchdog to describe Whipps Cross Hospital in North East London. Unannounced inspections in May and June were carried out on A&E, elderly, outpatient, maternity and surgery departments. Overall, the hospital failed to meet 10 of 16 national standards of quality and safety. A shocking result for an NHS trust already on a blacklist for patient care and hemorrhaging millions of pounds every week.
We saw people being treated without dignity and not with respect. Our inspectors actually had to intervene at one point to make sure someone got a glass of water, and saw someone else who, while waiting for a nurse to get to them, was forced to wet the bed.
3 formal warnings have been issued to the NHS Trust over cleanliness and infection control, safety, availability and suitability of equipment and support to staff. Serious shortfalls were found on maternity wards, including no oxygen in the machines used to resuscitate babies, blood-stained and unsterile equipment, and a sluice pipe leaking onto the floor. On elderly care wards there were staff shortages, water was at times placed out of reach, and feeding tubes weren't always properly checked. The findings come as no surprise to lawyer Mark Bowman. His clients claim poor care at Whipps Cross has caused life-changing injuries and even deaths. Over the last decade, he's seen a steady rise in complaints.
It's impossible to put into words the impact to these families. It's catastrophic. Sometimes loved ones dying, other times loved ones who are going into hospital expecting to come out with a better outcome, come out in a far worse position than they could possibly imagine.
Barts Trust has apologised for the failings at Whipps Cross. Its claims staff are getting extra training, but if patients are at high risk, many will question why it's still allowed to run hospitals at all. Enda Brady, Sky News.